So today I'm going to be telling you a little bit about my experience with the Honors Mentorship Program. So I do most of my shadowing at Legacy Family Eye Care, which is Flowery Branch's local optometrist office. It's right by the Publix off of Spot Springs Road, so you've probably seen it before. And then occasionally I will go to Advanced Eye Center in Gainesville and shadow cataract and retinal surgery. So this unique opportunity that I have to witness both an optometrist office and the way an ophthalmologist office works has really helped me distinguish the difference between these two similar practices. On my first day, I learned that an optometrist was the observer of the eye. So an optometrist is a person who will look at the eye, who will measure the curvature of the eye, who makes sure the prescription lines up. He basically checks that everything about your eye is normal. He looks at retinal photographs and detects any sort of disease. And if he does detect any diseases, he will refer the patient to a specialist. Whether it be something that's wrong with their nerves, he will send it to a neurologist, but most of the time it's going to be something wrong with the eye, so the patient will be referred to an ophthalmologist. So our optometrist is the observer, ophthalmologist is a doer. So the ophthalmologist is a person who's trained and specialized in optical surgery, so he or she will dive straight into the eye, take out the cataract or whatever it is that needs to be done. So at Legacy Family Eye Care, I'm currently researching the accuracy of optical technology and to what extent we can actually rely on its measurements. So optometry is one of the oldest practices of medicine, and prescriptions and eye measurements were once calculated using the monstrosity that is calculus. And surprisingly enough, calculus yielded a really accurate result. And I would like to know if the advent of technology has tainted this sort of accuracy, because every time I shadow at my mentorship, I see that the autorefractor has given yet another very inaccurate prescription reading. I would also like to explore optical technology and kind of predict what innovations are to come. So for instance, contacts. Contacts are a really big thing now. So they're actually trying to come up with some sort of technology to insert into a contact that when you put it in your eye, it'll be able to detect blood glucose counts, oxygen saturation, and IOP, which is intraocular pressure. So basically, whenever you go to an optometrist office, they will pre-test you with a little puff of air in your eye. And what that thing is doing is it's detecting your pressure, your interocular pressure. But the problem with that is that it's only detecting it for a mere 2-3 seconds at the most. So it's like reviewing a movie by only looking at 2 seconds of it. You can't really tell the health of an eye just by 2 seconds of data. So by using this contact, the patient will be able to wear the contact throughout the day, and pressure constantly changes. So the doctor will be able to make a better decision regarding patient's health by knowing way more information about the pressure of that patient's eye throughout the course of a day. So back to my mentorship. So when I go to my mentorship, the first task of the day is to get the mail. So I just get the key and then I go to the post office and I get the mail. And usually what's in the mail is magazines and contacts that patients have ordered. Then depending on how busy it is, I will shadow pre-testing and shove that little puff of air in a patient's eye. And then I will go in and sit with the patient and see what the optometrist is doing with that patient. And then after that patient has left, the optometrist will go over with me about what she's doing, talk to me about the photographs and what she's doing with them and what she's looking at. And it's always so surreal to understand what's happening. In, let's say, a retinal photograph. Well, I don't quite understand everything yet, considering the fact that medical school is a long, arduous 8 years. It still feels good to understand the mere symptoms of a disease. It's like the satisfaction of putting pieces of a coherent puzzle together. From looking up different drugs on Medscape to repeatedly observing optical tomography coherence scans, I'm definitely learning a lot. While it's nothing compared to what medical students learn, I got a glimpse of what practicing medicine would be like. I try to take advantage of any opportunity I have to learn, to offer help when I can, and to obviously ask as many questions as I can come up with. And this is why I think honors mentorship is vital, especially to students who have made up their mind on what they want to be in the future. Mentorship serves as this window, and it shows us only the truth. And sometimes the difference between expectation and reality can truly be shocking.